Protocol for adjusting these appliances. They're mandibular appliances that are titratable and adjustable. Our goals: AHI and RDI reduced by half. AHI less than 10, AHI ideally less than 5 if you can get it, but you may not. Minimize the time that their oxygen saturation is under 90%, and it should always be above 90% for 90% of the time, basically saying, they'll say how much on your monitor, what percent of time with the SaO2 less than 90, you want that less than 1% of the time. The patient and their sleep partner telling you that the snoring, gasping, apnea is eliminated, and then other goals is variable by the patient. When you're titrating one of these patients, the first week, don't titrate. Let the patient just get comfortable with their appliance. Make friends with the appliance. Advance the appliance about 1/2 millimeter per week, 1/3 of a millimeter per week. Every appliance is different. Know on your screws how much each titration is giving. On the Somden appliances, they use German screws. Each torque, 90 degrees, is 1/10 of a millimeter. So know that. Have the patient titrate until all the symptoms are gone. Then send them home with a monitor to see what's happening. Do some sort of sleep diary. So you know the sleep results: snoring resolution, symptoms, oral comfort, TMJ comfort, muscle comfort. Know that you want to know if they took alcohol, drugs, or had congestion, what position they slept in that night. Very important when you get weird results. Oh, I was out with friends, I had 2 drinks. Will make a difference. Have that recorded. You want the patient and partner report. You want to verify that they're getting to sleep on time, they're doing the right things, home screening monitor. Then when you think they're at where they need to be, you send them home with a better monitor. Don't send them to the physician if you're not reasonably sure that your appliance is working. It just makes everyone look bad. Appliance titration: use the monitor, find the sweet spot, maximally open the airway. Don't advance to the point of collapse of the lateral walls. You can over-titrate and decrease your results, and make sure you're getting joint and muscle comfort. Don't over-monitor the way I was. There is great night-to-night variability. Don't do one-night study and say, that's it. Because it may have been a good night, it may have been a bad night. Usually you do not need to increase the vertical dimension. A lot of argument in that area these days. Most studies show you increase the vertical dimension on females, you make their sleep apnea worse. You do it on males, in some cases you may help. You're going to have to spend some time titrating these appliances. There is a lot of trial and error, and it's not going to be you deliver an appliance and it's going to work and they're going to come back and everything's honky-dory. Isn't going to happen that way. So you work to patient comfort and results, witnessed improvement, confirm with the monitor, have them follow up with the physician. Do understand that appliance titration is a dynamic thing. Once you get to the position that even it's most effective, it's not going to be most effective at that time. The improvement continues over weeks and months. Some studies by Fernanda Almeida, again out of British Columbia, that show keep them in the right position, treat the GERD, and you'll see improvement over the next few weeks. Let the patient titrate to the results they're looking for, reevaluate, and you will always increase your treatment success by resolving nasal obstruction and resistance. So appliance titration, your numbers reduced by half, less than 10, those problems eliminated, you're keeping your blood oxygen saturation up. Look for your heart rate not too variable. One of the things the pulse oxes look for is the heart rate should be fairly steady. If you're going up and down, you're having apneic periods. Get updates to your MD, what appliance they're in, the original AHI, the current AHI, the results, what they've resolved, any current problems, and things you've noted about sleep hygiene. Physicians want to see those reports. Learn to fax some reports on a regular patient. You'll get respect that no other dentists around you are getting because you're giving them follow-up studies and they need them. Males, you may increase the vertical dimension. Shimbashi number is the measurement between the CEJ and the CEJ of 8 and 25 or 9 and 24. It should be in the 18 to 20 range. If someone is overclosed, you're generally very safe opening them up to a Shimbashi number of 20, 22. Some people define their bite position by opening up to Shimbashi of 20, 18, 20, and then increasing the vertical dimension another 4 to 5 millimeters. Larry Tilley in Calhoun, real good guy on TMD, worth hearing. He uses that approach. Females generally do not increase the vertical dimension. You want to keep minimum appliance thickness so it's not going to break. Mouth opening retracts the tongue, occurs to a major degree in a third of the patients. So don't be so quick to increase vertical dimensions.